Hello, good afternoon. My name is Silvia. Welcome to my collaboration and leadership video for Nursing 44010, Leading People, Processes, and Organizations in Interprofessional Practice. In this presentation, I will reflect on an interdisciplinary collaboration experience, noting how it was successful and unsuccessful in achieving the desired outcome. Identify ways poor collaboration can result in inefficient management of human and financial resources, supported by evidence from the literature. I will identify best practice leadership strategies from literature to improve an interdisciplinary team's ability to achieve its goals. Identify best practice interdisciplinary collaboration strategies to help a team achieve its objectives and work together more effectively. Communicate professionally while speaking clearly and using proper grammar. I will cite work from reputable sources. I have been a nurse on a 14-bed med-surg unit at my local hospital for 3 years. For this presentation, I will discuss when I had to collaborate professionally with 3 different disciplines to help ensure my patient would receive a medication that was needed promptly. My patient was being treated at the local mental health clinic in the community, where she gets a monthly injection to help control her psychiatric symptoms. The patient was admitted to my unit. She was admitted for syncope related to diarrhea and dehydration. She was also found to have pneumonia on her chest x-ray. The patient was admitted for IV fluids and antibiotics and was under my care. While administering my morning medications to this patient, she received a phone call from her community RN from the mental health center. She was making her weekly phone call check-in. The patient stated to her that she was admitted to the hospital because she was not feeling well. The RN asked to speak with her care RN at the hospital. I spoke with the RN and we discussed what the patient was admitted for and her possible length of stay. The RN then asked me if the patient had received her monthly injection for her psychiatric disorder. The nurse was concerned if the patient did not receive her medication that her symptoms might flare up, including hallucinations and paranoia. I reviewed the chart and there was no reference regarding this in her medication reconciliation, which is done on admission by the pharmacy. I told the nurse I would pass this along to the pharmacy and the attending physician to ensure timely medication administration. I obtained as much information as possible from the nurse regarding the needed medication, including the name, dose, and strength, and received a copy of the last administration date. I ensured the fax was scanned into the patient's chart so all team members could review it. I then contacted the attending physician and pharmacy via Secure Chat, our internal messaging system. The best practice for our hospital is that when a patient is admitted, the pharmacy should perform a medication reconciliation to help with continuity of care. Research by Albadini 2021 suggests that a structured medication reconciliation framework is essential to lower medication errors and reduce patient harm, improving overall healthcare efficiency and leading to higher quality care. The nurse should also review medications, including over-the-counter medications the patient might not have disclosed to the pharmacist. After sending a detailed message and writing a note on the patient's chart, the patient and I waited for a response. I was unsure if the patient could have her medication here. Would it interact with anything we were giving her to treat her? Was it a medication we have available? Sometimes we don't have all the medications a patient might take regularly, and then the attending and pharmacist must decide to prescribe an alternative, if possible, or if the risk of going without the medication would be better. The only response I received from the physician for the remainder of my shift was "okay, noted." Even after sending follow-up messages asking if he was at least reviewing it with the pharmacy and if the patient could get the injection while hospitalized. I also received no follow-up communication on the status from the pharmacy. Communication was successful and unsuccessful in this scenario. The community nurse and I understood the importance of the medication and communicated with each other. I communicated my patient's needs to interdisciplinary sectors such as the physician, the pharmacist, and the community nurse. According to Schott 2020, making oneself available to others and actively sharing knowledge or information from one expert to another are the two aspects of bridging communication. Nurses are often the liaisons who communicate medical information to other professionals. The unsuccessful aspect of the scenario was the lack of communication I received back. The only response I received from the attending was barely acknowledging the situation. There was no indication that he was reviewing with the pharmacy. I was sure to send appropriate and professional inquiries throughout my shift without a response. By the time I finished my shift, I still had no answer for the patient as to whether she was going to get her medication while she was hospitalized or would have to wait for discharge and be late on receiving the medication. The physician and pharmacist could have had respect for the members of this disciplinary collaboration and tried to communicate better. Some information would have been better than none. Even if they were discussing the risks and benefits and hadn't come to a decision yet, I could have relayed that to the patient and her community nurse. Poor collaboration and its effect on humans and financial resources. The effects of poor collaboration in this scenario led to ineffective care coordination. The team did not collaborate fluidly. Ineffective care due to poor communication caused a delay in treatment. This scenario of poor collaboration also led to decreased morale. The lack of communication made me feel unsupported and unheard. Identify best practice leadership strategies. Transformational leadership is one of the best practice leadership strategies. Leaders can engage their colleagues and help employees consistently engage patient care by creating a common goal and supporting individual development. Leadership should have effective communication, should be straightforward and unambiguous. By utilizing these leadership strategies, healthcare leaders can improve patient outcomes and increase employee productivity and happiness. Identify best practice interdisciplinary collaboration strategies. The various styles, expectations, and educational requirements of each healthcare profession must be considered when working to collaborate and foster interprofessional communication. Stewart, 2018. Research by Schott, 2020, suggests interdisciplinary collaboration is commonly understood within healthcare as a dynamic, continuing partnership between professionals representing different organizations and with unique professional cultures working together to provide services and benefits to patients. This was not the case in my scenario, unfortunately. Thank you for watching my collaboration and leadership video. Thank you and have a great day.